Good evening. My name is Caitlin Esther, and my healthcare resolution paper was on fighting the opioid crisis in the United States and how healthcare providers can help. As a critical care nurse, I have seen opioid addiction a lot in patients, and I really feel that this is an issue that healthcare providers in today's environment have to address. Some current statistics. Today, there are 2 million people in the States addicted to prescription opiates alone. And on daily, 115 individuals die from overdose. Annual cost of opiate addiction is $504 billion in taxpayer money that's used to cover legal and medical costs associated with opiate addiction and overdose. Some contributing factors are overprescription. Prior to the 1980s, opiates were strictly reserved for surgical patients and for cancer patients. After the 1980s, 1990s, there was an increased push for pain management, especially long-term pain management. And the Joint Commission and the Centers of Medicare and Medicaid began to really promote this. Providers actually started facing professional repercussions if they didn't manage pain adequately. And as a result, they began prescribing more and more pain medications, including opiates. Also, they were provided with information that the risk of addiction to opiates was minimal, and there was no maximum safe dosage. However much the patient needed was appropriate. As a result, a lot of people got addicted to opiates. Proposed resolution. Resolution of the issue will be demonstrated by decreasing numbers in recorded cases of opiate overdoses and new cases of addiction. Plan of action is better screening for providers prior to prescribing opiates to see whether an opiate prescription is actually appropriate for the condition they are prescribing it for, and limiting long-term use of opiates, increased education for providers regarding outpatient and inpatient treatment for opiate addiction, and possible using alternate forms of pain management as well. Resources needed. Some resources that healthcare providers need to help assist people with opiate addiction is education regarding on how they can help these people, what treatments are available, such as outpatient medication treatments, or referring these people to inpatient rehab, and improved availability for treatment programs for patients who may lack the resources to pay for the treatment themselves. I feel that if we help these people battle their addiction, it would actually save costs in the long term and improve the lives for many people. So that's my proposal. Thank you, and these are my references that I use. Thank you, everyone.